It is not yet one now, please.
Namaskar, everybody. As we all know, आजकल जो हालात वारिया खराब इंडिया में, and we are all very worried. तो हमने जैसे कि आपको पता है यूरोप और यूएस में काफी टाइम से कोविड चल रहा है. So we have already gone through the second wave, like India is going at the present time. तो हमने कहा यहाँ से बैठ के परेशान होने से बेटर है that we try and do something. So lot of us are part of WhatsApp groups trying to give advice. पर आज हमारे साथ विमर्श रैना जी है, डॉक्टर विमर्श रैना. ही इज अ स्पेशलिस्ट इन विस्कॉन्सिन एंड इंटरनल मेडिसिन स्पेशलिस्ट. और यूएस में जब कोविड का प्रकोप हुआ था तो विमर्श जी वाज एट द फोरफ्रंट of managing the patients, like most of the doctors abroad. So we are today is the first of the series जिसमें हम COVID के बारे में बात करेंगे. And we just hope and pray that कि जैसे यहाँ यूरोप में थोड़ा अभी प्रकोप कम हुआ है और यूएस में, but it comes in waves, so कुछ पता नहीं है आगे क्या होगा. तो ये सैन आख बहुत ही छोटी कोशिश छ सानी तरफ कैसे मेली अगर क्या एडवाइस अगर मेली कैसे we will be really grateful and honored कि अगर थोड़ा सा भी हमारे से कुछ को एडवाइस मिले. Especially people like Dr. Rana, like I said, he has worked at the forefront of the COVID pandemic in USA. So internet is such a various cheese COVID worldwide प्रकोप at the moment. Various doctors are coming on the net and talking about things, which is excellent. पर हमने आज सोचा कि थोड़ा इंटरैक्टिव करते हैं. अगर कहीं से सवाल कोविड से मुतल्लिक बिकॉज अभी इस वक्त लोगों के पास उतना एवरीबडी इज वेरी हम बहुत परेशान हैं. रिलेटिव्स हमारे इंडिया में हैं एंड सो मेनी पेशेंट्स आर बीइंग अफेक्टेड. सो अगर ये छोटी सी कोशिश हेल्प करेगी तो यही है हमारा मकसद आज का. दिस इज द फर्स्ट. अब हम और भी करेंगे. वी आर ट्राइंग टू डू वन एवरी डे, बट लेट्स स्टार्ट विथ टुडे. अगर किसी के क्वेश्चन प्लीज पुट इट इन द इधर ज्वाइन द जूम लिंक जो हम अभी फेसबुक पे डालेंगे, या आप फेसबुक पे क्वेश्चन डालिए और we'll ask Vimarsh the question and he'll try his best to answer it. So after you, Vimarsh. Sorry, before we introduce Vimarsh, I would like to ask Dr. Surinder Kaul, because he himself has been working with COVID patients for more than a year now. So Surinderji, do you want to introduce the series and why we are doing it like we are from today?
Yeah, namaskar to everyone. We are coming in at a very difficult moment in India where this pandemic is going out of proportion and assuming an alarming dimension. So, having had some experiences in dealing with the COVID patients, what the least we can do is to provide a window of opportunity so that the patients or anyone, the caregivers, can ask direct questions to the physicians who have experience in COVID management. This is very important because most of the management can be taken care within the comfort of the homes. And this will include hands-on training, understanding a particular situation with the patient or with the family, and provide a window that what needs to be done. So this I could use a disclaimer that please use your physician's advice also. And our process is to supplement. The healthcare workers, we have brilliant physicians in India, and especially from our community, and they are all overwhelmed. If the family is trying to reach them, he or she, they are busy in providing care in their hospitals. So you may find it frustrating that you are reaching out to the physicians or your local physician, your personal physician, but they are not available. So as a window, we are creating this whole space so that you look forward that, okay, we can have an opportunity to ask a question and your circumstances directly to the physician. So that is the initiative. I also would like to mention that, in USA, we have a very strong organization that is Kashmiri Overseas Association, which has been doing a phenomenal job over decades. And I am part of that KOA healthcare network, which was established in 2014. And we have all the physicians of KOA healthcare network who will be part of this initiative. And Dr. Vimarsh Rana, our today's guest, is also part of KOA healthcare initiative. And I myself there, and our president, Dr. Archana Kapru, herself is a physician. And this organization has done a phenomenal job over several decades when we are all part of it. But besides physicians from the US, we will also have physicians from UK, Australia, New Zealand, and because the Indian physicians are busy, and we will be providing that window to you to ask direct questions to all these physicians who will be pulmonologists, lung specialists, infectious disease, cardiologists, and on different facets of this COVID or some other issues that you have, you can ask these direct questions. So I don't want to take much time, and I want to come on to our first guest, Dr. Vimarsh Rana. He is a very outstanding physician. He's an internal medicine specialist who has been dealing with COVID patients directly. And he will be answering your questions directly. So, Dr. Vimarsh Rana, please do join in and give an introductory brief, then open it for the anybody who has any questions. My apologies that we had some glitch with our original Zoom link because there were some glitches that's not working. We are trying to set that right. In the meanwhile, you have a Zoom link, use that for asking questions. Back to you, Shafalika ji.
So thank you, Surinder ji. जैसा आपने बोला एक कोशिश है first in a series. So without wasting much time, I think people have already started sending a question. So Vimarsh, Dr. Rana, do you want to start off by giving a bit of introduction on what you do and how it has been? Like I said, the US has already gone through the second wave, so we have all suffered. Do you want to start with that, and then we'll start with the questions?
Sure. Thank you, Shafalika ji. Thank you, Surinder ji, for the introduction. Briefly about myself, I did my MBBS from Jammu, and after that, I moved to the US. I did my residency in Washington, D.C. in internal medicine. And then I decided to work as a hospitalist, and I moved to Wisconsin. Wisconsin, I'm working as a hospitalist, and I was at the forefront for the past year and a half, treating COVID patients. Excuse me. Just to clarify what hospitalist here means, because हम लोग India में hospitalist concept अभी शुरू हुआ है. I'm basically involved in patients who get sick enough and then they land in the hospital. I'm the one who admits them to the hospital, manages them throughout their stay in the hospital, and then discharge them from the hospital. I've seen patients do very well with treatment. Most of them do good with the kind of treatment which we have, but all of us know that we don't have a concrete cure for this disease as such. So that's where a lot of panic comes in as well. What I see right now in India is very disheartening. I mean, people are sick. A lot of them are not able to get supplies as well, and there are not too many hospital beds available as well. Oxygen is in short supply as well. So, in a way, US has gone through that a similar phase as well, where there was a lot of panic in the community as well. A brief introduction about this virus. We found out about it in early 2019. And I'll switch between Hindi and English. So उस टाइम पे हमें पता चला, हमें पूरा पता नहीं था exactly what kind of how is it transmitted, but now we know much better about it, that it is transmitted through the respiratory droplets. And there is some fomite-borne transmission as well, which means कि अगर आपने किसी door handle को हाथ लगाया जहाँ पे कि already ये droplets पड़े हुए हैं, there can be some transmission through that as well, especially if the conditions are very favorable, like the temperature is very favorable as such. But the majority of the transmission which happens is through droplets. There's another term called as airborne. Yes, it can be airborne in certain situations. For example, अगर कोई nebulizer use कर रहा है जो COVID patient है वो nebulizer use कर रहा है and it forms very small droplets. That way it can stay in the air for a longer period of time as well. But if you ask me what is the major modality of transmission from one person to the other, it basically is through respiratory droplets. What we've seen is that the droplets by which it is transmitted is relatively bigger in size. I won't go into detail kitne size ka hai, kya hai, but what we have seen is that these droplets, when they come out of our respiratory system, they usually don't land more than 3-4 feet, and that's why we say कि हम लोगों को social distancing maintain करनी चाहिए, and that is one of the biggest things which can help sort of break this chain and break the spread in India as well. So maintaining a 6 feet of distance is the most important thing. The other thing is to use a mask which covers our nose as well as our mouth as well. That is very important as well. So basically what that does is that it prevents those droplets from coming out in the air. जो normal surgical mask हम use करते हैं जो ऐसे flat होता है, there is still some possibility that droplets can escape that. It can still come in the air, and that is why the social distancing is very important as well. And you know, one big there has been a lot of debate here in the US, you know, that mask use करने चाहिए नहीं use करने चाहिए. There is no evidence behind the mask. That is also what some people talk about, but you can't really do a randomized control study कि mask काम करता है कि नहीं करता है. It is sort of just a common logic that, you know, if you are sick, you want to prevent the droplets from coming out into the air, I think we should use the mask. And that is the main reason why when you go into a hospital where their providers are taking care of COVID patients, we use PPE, which is personal protective equipment, like just make a mask, gown, वगैरह वगैरह चीजें भी पहनते हैं. So I would say that there is good logical evidence that mask and all those things work very well. Other than maintaining social distancing, frequent hand washing will help as well, especially in the case of India, जहाँ पे कि climate is very suitable for this, the replication of the virus. Plus, in crowded spaces, that is going to help as well. And then, you know, most of the times what will happen is that what we have seen is that almost 80% of the patients who will catch this virus, let me first go with what the signs and symptoms of the disease will be. So the most common signs and symptoms of the disease are like cough, fever, chills. It's basically like a virus, but just much more severe symptoms, which we've seen with the COVID-19 infection. One of the other things which we have noticed is that people lose their ability to smell and or taste as well at times. So that's something which we have sort of seen more peculiarly with COVID-19 infection. There are a few other things as well, like muscle ache, body ache, sore throat obviously is there. Some people just have a diarrhea and no other symptom as well. There are people like that as well. Some people just show signs of headache and some mild body ache as well. So there's no clear-cut 1, 2, 3 kind of a symptom which you can attribute to that this is sure shot a COVID infection. There are a lot of people who call me in the past few days, past few weeks कि, you know, मेरे को बुखार नहीं है, but मेरा गला खराब है. And someone else in my home was sick as well a few days back, or they were in contact with someone who was sick. My advice to them is that just presume that this is COVID until proven otherwise. In fact, I'm not even sure that the kind of testing we can do nowadays is 100% sensitive for COVID as well. I'm just presuming it. I don't have any data for that. But that is what I would say, that, you know, if you have symptoms which seem like might be consistent with having a COVID infection, just presume that you have COVID and isolate, quarantine yourself from others so that you don't spread it to others. But on the other hand, be careful that how are your symptoms? Almost 80% of the people, I would say 80 to 85% of the people who contract this virus, they have mild to moderate symptoms as such. Like, you know, they will have body aches. Some will have mild body aches. Others might have like very bad body aches where they don't even feel like getting out of the bed and doing their day-to-day activities. So for those patients, what I would say is that just quarantine yourself, The only thing which I would say is that make sure that you can get a pulse oximeter for yourself, because one of the most sensitive things which we have noticed is if the patient needs help in a hospital is that if the oxygen saturation is dropping. Normally, our oxygen saturation is anywhere more than 95, 96%. In younger people, it can even be like 99% as well. But there are situations where our oxygen can drop even up to like 90%, and people cannot have, and it does not harm the body, I would say. Here in the US, the cutoff which we use is about 92 to 94%. If the patient has that much amount of oxygen, we admit those patients to the hospital. But again, that is not always. We sometimes take it on a case-by-case basis as well. Some patients say that, no, I don't want to go in the hospital. Give me some treatment and I just want to go home because my quality of life and quality of care will be better at home as compared to being in the hospital. And I think that is something which is very valid for India right now as well, because we do not have sufficient hospital beds for all the patients. What we literally need to do is triage the hospital for patients who are sicker enough, who really need things which need to be done in the hospital. Now, from a severity point of view, what can we do if you have some mild symptoms? So mild to moderate symptoms, you just take care of yourself at home. You can, I sometimes advise people to do some deep breathing exercises. Some people who have some mild symptoms and their pulse ox is okay, I even tell them to prone themselves. So sometimes they can do like, what proning means is basically they can lay down on their chest, and that sort of helps them breathe better as well. क्योंकि होता क्या है कि when we prone, the blood supply in the lung, it sort of shifts, and because of that the oxygenation improves as well, so sometimes they feel better as well. So what they can do is that they can lay on their chest for say about half an hour, or sometimes even up to 2 hours, as long as they can do it, and that might make them feel better. This has actually shown to improve oxygenation as well, but I won't suggest this. I won't suggest people to just stay at home if their oxygen levels are lower than say like 90%. Then I think they need medical attention. Some other things which we can do for symptom management is that we can use some anti-allergic medications as well. We can use some anti-cough medications as well, although we sometimes try to tell the patient that avoid it. If you're coughing up, if you're moving that phlegm out, that actually might be good for you rather than all that phlegm staying inside the lungs, inside the bronchus. So those are some of the things which you can do in the milder situations.
So,
I'm sorry.
Thank you, Vimarsh, for that. Triage सबसे important बात है क्योंकि what we have seen in the West, the criteria, admission ki criteria are very strict. And so, which I guess एक sense में अच्छा भी है, और although that जो बीमार होता है उसको लगता है कि मैं किसी तरह से hospital पहुंच जाऊँ, there is that reassurance of going to the hospital. But the problem with not having a triage is that sometimes the bed might be occupied by patients, especially in the beginning of the surge, by patients who really don't need to be in hospital, at the expense of people who really do need to go into hospital. So the system of triage, what you mentioned, is really important. So Vimarsh, we'll take some questions today, but before that, I wanted you to just talk a bit on the difference between social distancing and self-isolation, because there is still some confusion. So what are the criteria for strict self-isolation, which is once you've got the symptoms, even if it's the beginning of a fever or something, how should you isolate yourself, and how is that different from social distancing, which is advisable for the general population?
So social distancing is advisable, like you said, for the general population. This is for people who don't have any symptoms, who we don't think have COVID infection as such. So if you have to go and do something like groceries लानी है, घर के लिए खाना बनाना है, obviously कुछ लोगों को बाहर तो जाना पड़ेगा. And some people, like even healthcare people, they have to go to their work, take care of patients in the hospitals. So people who have to go outside their home, they should always maintain social distancing. So दूध लाने जाना है, try to maintain 6 feet different distance from others who are around you. Mask पहनना है as well when they go outside. And so whenever you go outside, maintain social distancing. But this is only for people who do not have symptoms, who are not sick, and they are the ones who should go outside and maintain social distancing. As soon as this person who thinks that he's okay, no symptoms, if anybody starts to have any symptoms and they think that no, they might have the virus, they should isolate themselves. They should quarantine themselves at their home. So people who have few other family members, what they do is that, or what I would suggest is that they should sort of quarantine themselves in a separate room. Uh, Others should help them, say, eat or drink in that room. If they have to go outside that room, say use the restroom or other places which are common, they should make sure that they use a mask even in their home when they go into their bathroom. And whatever they touch, they should clean that and then come back and sit in the room. Uh, this might not be possible for everybody to be done. Some people just live alone in that home. Now, there are a lot of social organizations who are helping people out with that as well. I've heard restaurants who are supplying food to others at home as well. And even here in the US, even now what we do is that we try to not deliver hand to hand food. What they try to do is that they leave the food outside the door, ring the bell, or call the person that I'll be there, just leave the food, and then the restaurant guy goes away. So again, that is sort of a social distancing which the restaurant guy is doing, but a quarantine which the person who has symptoms who's doing at home. One more thing which I want to mention over here is that in this pandemic right now, we cannot go ahead and test everybody. So we might be at a point where, कि अगर हम लोग जाके कोई आके हमारा टेस्ट नहीं कर सकता है, या if testing is not available, just just take for granted that if you have symptoms which are similar to COVID-19 infection, you just quarantine yourself for it. You don't really need to go and test yourself out for that. Now, I don't want to say that as a blanket statement, because many people can have different other conditions as well, which need to be differentiated from COVID-19 infection. People can have a community-acquired pneumonia as well, which can be bacterial. They might need antibiotics for that as well. So we sort of have to differentiate those people as well. And that is where I think if they can have a telemedicine session or something with their doctor, they might be able to triage those patients as well.
Right. Okay. So we have some questions which I would like to go through. So on people who have joined on Zoom, one of them had a question about antibiotics from Akansha ji. Are antibiotics helpful, and at what stage should we use steroids?
So, this is a viral infection. The only viral infection commonly which we treat is influenza with Tamiflu kind of medications, which also the evidence is limited. Like it helps limited kind of patients. In in COVID, there's no antiviral which works as such. Although I know there is some data on. There's a newer antiviral. It starts with a favipiravir, which is used, but still there's a consensus that no antiviral works for it. Now, antibiotics are used for bacterial infections. So when you have a COVID-19 infection, antibiotic will not do anything. It will not change the outcome of the disease. Now, in the past, we used to say that hydroxychloroquine and azithromycin might help this as well, because in vitro studies, which mean like test tube में या research lab में जो studies की थी, it showed some benefit, and we have known that benefit for a long time. But then when this was used during the COVID-19 pandemic initially, the studies did not show any benefit. So in the US, we've stopped using all antibiotics or antivirals as well. We don't use any hydroxychloroquine. We do not use any Zithromax. We don't use any other antiviral as well for COVID-19 infection. Now, sometimes there are people who start with the viral infection, but then have a concomitant bacterial infection on top of that as well, which usually happens later on. It does not happen right on day one. So in those patients, we might have to reassess and use antibiotics as well. But as such, for COVID-19 infection, initially, when the person contracts that virus, there's no role of any antibiotic at that time. In fact, there might actually be some harm with some of the antibiotics, depending on what the person's other medical conditions is. Some of these antibiotics can cause harmful side effects as well, especially azithromycin, Zithromax, Z-Pak जो use करते हैं. It can have some cardiac side effects as well. The same thing, although hydroxychloroquine is not an antibiotic, I'm just talking in similar it together with Zithromax because it's used in combination in India nowadays, has been used. But that also has some cardiac side effects as well. So we try to avoid using that as well. And then both these things together increase the side effects more as compared to just one being used as well. So, I would suggest talk to your doctor and see if the doctor thinks that there's a bacterial component to your infection as well. But as such, for COVID-19 infection, there's no role of an antibiotic.
Yeah. So that is what we have found here as well. Because आपको याद होगा जब शुरू में COVID हुआ था, the hydroxychloroquine was a lot in demand, and because India में it's so easily available, so a lot of people went, and even here in UK, a lot of people were trying to get hydroxychloroquine from India, thinking that जब होगा COVID उस time we'll just take it. But like you said, subsequently there has been very minimal or no evidence of both hydroxychloroquine and also the other one, the ivermectin, all those things which came out at that time. But azithromycin also only for super added infections, not to be taken routinely, because then there's resistance because azithromycin is quite a strong antibiotic, and there is possibility of resistance to it. So it should not be taken without medical advice. The other thing about hydroxychloroquine is you have to get an ECG done ideally, especially if you are in the elderly, in the 50s, in the 60s. You should get an ECG because of the cardiac side effects of hydroxychloroquine. So the second question we have is from somebody is, how do we sanitize the room? This is a very important question because what does sanitizing a room mean? This would, I guess, this would be after. So किसी को COVID हो गया, फिर वो ठीक हो गया. पर room को तो फिर भी we have to sanitize the room. So what is the time scales around that? कब करना चाहिए, or what products we should really use to sanitize the room, and how soon after the infection does the room actually become sanitized for other people to use it again?
Sure. So I'll give you the perspective of what we use in the hospital as well. So I think that is probably the best case scenario for a home as well. So in the hospital, what we do is that as soon as a COVID patient leaves the room, although that room which we have usually for COVID patients, we keep that room as a negative pressure room. So what basically that means is that the room is very well ventilated. The air does not stay in that room, because the droplets, can stay in the room, although they don't stay for a long time, but sometimes the nebulized drops or small drops can stay in the room for a longer period of time as well. So when you say sanitizing a room, I think ventilating a room is one of those first things as well. So कोई खिड़की या कुछ है वो खोल दें बाहर की ओर, I think that might be a good first step as such. The second thing would be to clean all the surfaces. Now, it depends. If you know that what all has the patient touched, you can clean that, and I'll come to what we should use for cleaning as well. So the things which the patient has touched, we should clean that or wash that, especially in say 6 to 10 feet area around that patient where that patient was. Now, what kind of products do we use? Any alcohol-based wipe is going to work very well. Most of the products which are available in the market, they label it as like something like it kills 99.9% viruses. I think any of those products which is available over there should be okay, as long as it says that, or it's a good alcohol-based product. I don't know many brands which are available in India as such, but I think this might be a good general approach that any antiviral wipe which is available in India should be okay, and you can use that thing to clean the places over there. The other thing which sometimes we do is that, and I'll give you an example of hotels here in the US. What they do is that whenever a person stays in a hotel, the hotel does not get another, some of the hotels at least, they don't get another guest for the next 24 hours. Because what we have noticed is that for 24 hours, these droplets can stay as fomites anywhere in the room or any place as well. So it sort of is a natural barrier. 24 hours the virus might die away, which we know that it does die away most of the times. So that might be another way of doing it, like not go or not use that room for say 24 hours, or clean after 24 hours is another strategy which can be used as well.
Yes, yes, that is very right. And here, I think the advice was to wash the clothes in at least 60 degree centigrade high temperature में जो कपड़े हैं उनको गर्म पानी में धोना है, उससे भी all the fomites and everything are killed, and then you have to dry them outside, air drying rather than in dry. So simple measures like that are, I think, very helpful. And alcohol is considered a good disinfectant in COVID. So alcohol, jin wipes mein alcohol hai, it's probably best to use it. So there is another question, which is that there is this thing that is a mutant virus. So what is there any? It's a mutant coronavirus. Is it true? And what is the mutation we are talking about?
Yes, so there are different mutations which are there. I mean, people might have heard about a South African variant, UK variant. So there are different names commonly which are attributed to it. But there are some particular medical names as well which are used, like I think B117, B12, those kinds of things. In fact, even here in the US, we've seen a shift from the original virus, which was like the B12, I think was the original. Now we have seen a shift to the B117 as well. So all the viruses which humans get infected with sort of have the capacity to mutate. Some viruses have a more quicker capacity to mutate, others have less of that. And the same reason is why we have a new flu shot every year, because we sort of try to take care of some of the mutations and some of the variations which happen seasonally in that. So there are different mutations, but for all practical purposes, all treatment methodologies, all sanitization and social distancing, they are the same. Some virus mutations are known to be more infective as compared to their virulence is higher as compared to others. Some are known to have a worse outcome as compared to others as well. And we don't have too much data right now about it as well. At one point, we thought that one of the variants had lesser mortality as compared to the first variant which was there. But now we know that it might actually be either the same or even higher. But for all practical purposes, the treatment-wise, isolation-wise, there's not much difference, not any difference, in fact.
Thank you very much. So Nirja Sadhuji, you had a question, and I've unmuted you.
Dr. Vimash, I have a question which actually I had personally, because I am actually vaccinated, but I am experiencing fever, chills, some body ache, which I'm hoping it's just the change in season. But what protocol should I follow? Should I go for a testing? Should I just isolate myself? Because everything now comes down to COVID. So as a layman, I would like to know from you, though I have consulted my doctor, but I still need to know, and a lot of other folks might also want to know, because I see a question here that people are getting infected even after vaccinations, which is bound to happen, but it's not going to be so severe. And you can explain it a little bit further.
Sure. So there are a couple of things which I want to touch in the question. This is an excellent question you brought up. The thing is, your question was that what should you do? What we need to do, the treatment needs to be personalized based on the person, plus where you are as well. So if you had similar symptoms here in the US right now, if your clinic was able to do testing for you, what I would advise you to do is that go to your doctor's clinic, but tell them that you might have these symptoms. Go to the clinic, get yourself tested, and then the next steps will be depending on what the outcomes is with the COVID test. In India, I think, and I'm sorry, I don't know right now where you are, but if somebody in India has similar symptoms right now, I would advise them to just stay at home and quarantine themselves and just think that this might be a COVID infection and you don't want to spread it to others. Plus, you don't want to go outside too many places to find out if you can get COVID tested or not. On the other hand, you might be in the initial few days. What we've seen is that you might even start some mild symptoms initially, and you might even be negative. Especially, I've seen this with patients in India as well. The timeline which we have normally seen is that if a person gets infected with the virus, the first 3 to 4 days, they don't have any symptoms. And most of the times they are negative as well when you do a COVID test. But they can still transmit the disease to others. So just to take your example, I'm sorry to keep you on that spot, but you
That's
might be in a phase where you can infect others. So what the first thing, the most important thing which we have to do is keep you away from others so that you don't transmit it to others. Because right now we are in a place where we need to break this chain in India. Now, on the other hand, we also need to make sure that your symptoms don't get worse. So I think telemedicine helps at this point. So if you can talk to your doctor, either call your doctor and do a video chat as well. There are many things which we doctors can do even via telemedicine to figure out how the patient is doing. Like I've treated a lot of patients even in the inpatient setting via telemedicine. And one of the things which we notice is that, is the patient getting worse or better, like based on how well can that person talk? Like, can that person say full sentences or not? So your doctor might be able to tell you that, no, you are in a position where you can just stay home, quarantine yourself, get a pulse oximeter, and tell me if your oxygen saturation, say, drops below 94 or 92%, then I would like to talk to you again. And then if the things are getting worse, then go to the next level. And the next level usually is to take some medicines like steroids, and that can be done at home as well. Yeah. So the other thing which I wanted to touch upon was that you mentioned about vaccination. I would highly encourage everybody to get vaccinated as soon as they can. People might have heard about the vaccine is 80% effective, 90% effective, but that effectiveness is basically what is the antibody response to that vaccine. What is interesting is that we've seen that even though the antibody response might be like 80, 90, 95%, the percentage of people who get severely sick after the vaccine is almost zero. I can give you my example. I go to a couple of nursing homes. Since the patients in those nursing homes, and these are elderly patients, since those patients have been vaccinated in the nursing home, not even a single patient has landed in the hospital with a severe COVID infection, not even a single one. So that is what I would like to, mention, that, don't go by a lot of misinformation which is available online that, vaccination might have side effects. I agree. Many vaccines can have side effects. There can, in a very rare circumstances, you can have something with a vaccine as well. In fact, when I got my second COVID shot, I've been vaccinated. When I got my second COVID shot, I almost lost consciousness at night. But you always have to weigh the risks and the benefits of this vaccine. This vaccine is going to save a lot of lives in future.
Absolutely. Thank you so
The
much.
other thing,
Go ahead, go ahead.
the other thing which I wanted to say is that getting vaccinated does not mean that you will not catch the virus. You will still catch the virus. You can still transmit the virus. It is just like any other vaccination. We in India have been vaccinated against polio, many other viruses as well. We still get that virus in our body. We might get a little febrile, a little shakes and chills, but usually our body has already developed response because the vaccine has trained our body to fight that infection. So it ramps up that infective response quickly and fights that virus. But during that time, the virus can still be transmitted to others as well. So you still have to maintain social distancing. You still have to maintain the fact that you need to wear a mask as well. So all those things are are the same for people who have been vaccinated or people who have not been vaccinated.
Sure. I think there's a question related to this only that somebody put in the chat box. Should we consider every fever and body ache as COVID? As people get panic and, there's panic, there's a lot of panic around. So if you could just.
I'll tell you what I think about it. In India, when I did my MBBS, हमारी book में लिखा था, every fever should be treated malaria unless proven otherwise. That is how we used to do, because everybody could not be tested for malaria. There was a lot of variation in testing for malaria. It is not a very simple test as well. And what we used to do is that if somebody had fever and looked as if this was malaria, we used to just start the medication at that time. I think we are in a similar spot here as well. If there's a fever, if there are symptoms, you presume that this is COVID infection, yes, and you quarantine yourself. Unless you have sufficient evidence to say that, no, this is not COVID infection, which I think might only happen if you test yourself and you have sufficient evidence after that no, this fever was with something else. Sometimes people can have other things as well, like influenza. You can have a strep throat. You can actually have a bacterial pneumonia as well. But to answer it blanketly, yes, right now in this situation, treat every fever, every symptom which is like a COVID infection as COVID.
Because absolutely right, Dr. Rana, because the thing is, this is even more serious than malaria, because by the time you realize कि आपको infection हो गया है, you might have spread it to 20 more people.
Exactly.
So and by the time your test comes back, if you're roaming around, not self-isolating, it might already be too late for your family. They might have already caught it. So thank you for that excellent tip. Now there is a question about home. Sorry, before I go to that, somebody has said that there's a senior citizen at present who had fever around 101, but today it's 96 Fahrenheit and oxygen is 95 to 96, but CT scan shows pneumonia. So what should be the next step? So the fever is coming down, SATs are 95, 96 on the border, but the CT scan shows pneumonia. That's the question.
So again, medicine has to be personalized. I cannot just generalize this thing, but I'll take some example and take some presumptions as well. If I presume that this was a healthy person who does not have any other comorbidities, we have two ways of here in the US dealing with this kind of a patient. But for India's scenario right now, where there are very little number of hospital beds and all, I think this might be the point where some steroids can be started. There are a few other things which can be done as well. There's a monoclonal antibody. Sometimes we can use that as well. And but I think exactly this is the thing where I think you need to talk to your doctor. You don't need to rush to the hospital with this. You need to talk to your doctor and tell them that this is how is going on. What is available around me? How can I start that kind of treatment? I mean, one thing which is very short is some amount of steroids can be started, even though most guidelines actually say that the steroids should be started like 94 and below oxygen saturation. But most physicians in this case, even here in the US, when they see some infiltrates on the CT scan, they would start some steroids. It also depends on what is the timeline of what we are seeing right now. Is this something which is after like 10 days after the symptoms had started, or is this something which is just a day or two after the symptoms have started? Because if this is just after the day or two, then I'll be more cautious in this kind of a person, because this person can deteriorate very quickly as well. I mean, honestly, I have given a blanket answer because there are many factors which go into it. If I wish we could have an algorithm which could treat all patients, but I don't think that is possible. You would need to talk to your doctor about it.
Yeah, it depends on the age, the comorbidities, how the general health of the person is. But yeah, once the SATs go to 95, 96, you have to be alert and keep checking and be cautious. The reduction in fever, I guess, is not that great indication that things are going either way. It's the SAT levels. So yes, so that I think that answers that question.
Can I say one thing here, Shafalika ji? So I just want to explain to people how does this virus work. The way this virus works is that it infects our body. but then it triggers our immune system, and that triggering of the immune system actually does even more damage. So just going that fever going down, like you mentioned, might not just say that the person is getting better, because the body's immune system might have been triggered to a point where it can still cause a lot of damage. In medical terms, it's called as the cytokine storm. And when a person is in cytokine storm, there are a few things which can be used. Steroids, though, is the mainstay at that point.
Yes. So now there's a question about home treatment protocol. So for mild COVID, like we said, there's no need to go to hospital really. If you can treat it at home, although you have to be cautious. But is there, so, like as soon as you get fever and there's suspicion that you might have COVID, there are some things, some do's. Do you want to go through the do's? This is purely for home treatment.
So for home treatment, again, I don't know if there are any guidelines in India, but there's no standardized recommendation as such. It is more like symptom management as such. So the first thing I always, like in the past 5-10 days, a lot of people have contacted me. So I've always told them that try to get a pulse oximeter. That is the most important thing, because the single thing which we have to do is we have to know is for how long can we keep you at home. So I've told them that, try to get a pulse oximeter. I know it has been difficult to procure pulse oximeter for a lot of patients, but even beginning of the symptoms, if you start trying to get one, I think that is one of the things. The other thing is then isolation. You need to isolate yourself. You need to isolate yourself, and you also need to know who else have you been in contact with. Probably tell them also that, I have these symptoms. I might have COVID. You might want to isolate yourself as well, because I might have given it to you as well. So I think that is another step as well. What that will do is that the other person is going to be alert that he or she might have caught the virus, and they can isolate themselves as well as much as possible. The other thing is symptom management. Like I mentioned earlier, that you can do some deep breathing exercises. You need to keep yourself well hydrated. Again, hydration is something which you need to make sure that you just drink as much water as you need. You don't need to overhydrate yourself as well, because there are patients who have, say, CHF and other things, and we don't want them to land in heart failure. So just drink as much as you need, but make sure that you keep yourself hydrated enough, especially with the temperatures in India. Then the other things are, like I said, deep breathing exercises. Here we do have a device which is called as a flutter device, a cappella. I'm sure something similar is available in India as well. Sometimes we can ask patients to use that as well. There's something called as a spirometer. It's a box kind of a thing. You take deep breaths with it. That can help as well. But just sitting at one place and taking some deep breaths will help as well. Now, one of the things which this virus does is that it sort of makes the blood thicker. So people have a higher chances of getting clots in their legs and even in their lungs, even sometimes in their brain as well. So what I would advise is that people should not just sit at one place. They should rest, but frequently move around, maybe in just the room where they are quarantined, or if they have access to the whole house, they should move around as well. What this does is that it makes the blood flow through the legs. It doesn't let the blood stagnate at one place, so that we can prevent clots from being formed. Now, other things which can be used for symptom management are if they have a lot of sneezing going on, they can use some anti-allergic medications which are there available over the counter. Cetirizine, loratadine, Benadryl, anything which they know that works for them. So that's something which they can use. Some people cannot sleep well because they are coughing so much, so they can use some cough suppressant medication as well. Usually what I advise my patients is that just use cough suppressants at night so that you can give your body some rest, because I do want them to cough up stuff. If they are bringing up phlegm, I do want them to bring up phlegm, because a lot of people, one of the factors which can lower the oxygen saturation is if a lot of phlegm gets accumulated in here, especially people who have COPD, who are smokers. So these are some of those things which I tell them to do. I don't know if you can think of anything else.
Yes, I mean, the other thing I could think of is, people who are already on for instance, a medication for diabetes, hypertension, they should religiously keep taking the medication and not stop. Especially aspirin is quite useful. Just don't stop any medication. If you have diabetes, it's a comorbid condition which does affect the severity of the illness. So maintain good blood sugar, take your metformin or insulin, and all the other medications you're on, and keep checking your blood sugar, because the risk of getting unwell with comorbidities is also high.
Yes,
So that's all I wanted to add on this. And some of the things you mentioned, like a spirometer and all, they are very easily available in online shops. So just get spirometer. We use here. It's just a breathing device which you just breathe. It's a regulated breathing device used by physiotherapists. But you can easily. It's not very hard to use. The only other thing I wanted to add was, people who have sleep apnea is quite a common illness, especially if you have obesity and you're overweight, and you use something called a CPAP machine or a BiPAP machine at home. So that has also been proven to be useful in these conditions. So if you're already using a CPAP machine at home, just keep using it. That's what I would say. And if you do get unwell, temporarily, you can use that positive pressure ventilation. So thank you, Dr. Rana. And
So
the other
Shafalika,
question.
just to add to your point, if there is somebody in NCR, which means Noida, Faridabad, Delhi, Gurgaon, and they are looking for an oximeter, there is a chemist pharmacy in Noida and in Delhi. He has got a couple of pharmacies in there, so he has got the supply. Because I had to get one for my brother today, so I got it immediately within a day delivered. Even though my brother had already ordered that from Amazon, but we got it delivered locally from there. So if anyone within the extended network is looking for one and is not able to get it because of whatever reasons, they can get in touch with Shafalika or Nirjaji or me, and I can point to the right person. So that is one. And then I had a question for Vimarsh. Vimarsh, like people say that if you do steaming and that will clear your nose blockage and maybe the virus also. I don't know if it's true or not, but does something like that happen? Because if we do alcohol fuming too, when you put, if you have alcohol in a glass and you put that glass in front of your nose, the fumes from it kind of tends to clear the nose. I don't know if it is technically true or not, but it happens.
No, there's no evidence for that. Not for transmission of the virus. So I see a lot of videos online where people say ki they will take fumes from alcohol or they'll spray alcohol in the throat, all those things. That has not been shown to prevent the spread of the virus. That might kill some of the virus which is around there, but this is a virus which is continuously replicating in the body. If you kill one batch of virus which is in front, there's continuous virus which is replicating in the body, and and we know that there are no studies which have shown that has so far that has worked.
Thank you.
Okay, thank you very much. So there's a question about somebody's brother-in-law whose SpO2 is 91, between 91 and 92. He's 70, non-smoker, very healthy, has taken one vaccine jab apparently. And what would be, obviously there is anxiety because at 91, 92, it's starting to go down.
Yeah.
So at that particular point in time, what would you advise them to do?
Again, it should be personalized based on that person, but from what I know and some things which I'm presuming, I would say this is a point where steroids can be started in that person. Now, in this person who's a smoker, we need to know what the baseline oxygen has been for him. Maybe 91 is his baseline oxygen, has been always his baseline oxygen. So then probably no medication is okay for him. Just quarantining is okay. But if we don't know what the baseline oxygen saturation for this person is because he has been a smoker, then we should presume that maybe he might be in a cytokine storm. And at this point, steroids can be used. So I think they should talk to their doctor, and see what the doctor recommends. There are other things which can be used as well. Like here, we do use remdesivir as well. But again, that's in the inpatient setting. We don't want somebody to just get admitted right now in India for getting remdesivir because it has not been shown to change the outcome overall. Again, one of the antivirals which I've heard is being used at this stage in India as well. I don't have much evidence on that, but this is a point where we have to weigh the risks and benefits of doing a treatment. So if their doctor thinks that they can use that antiviral for him, sure, that can be tried as well. But the mainstay should be steroids.
Yeah. So you said an important thing, and that reminded me about smokers and people who have chronic obstructive pulmonary disease like asthma and other chronic lung diseases. Their SpO2 is not going to be 95 and above, isn't it? So we are aiming for a lower SpO2 and which is considered normal. Do you want to add a line on that? People with COPD, asthma, and all. We are not wanting to get them to 98 or 99.
Yes, and let me start with saying that what so PO2 levels are okay for our body. So even though a healthy person might have a PO2 level of like say 99%, from 99 to 95, 94, even if it drops to like 89%, our body is getting sufficient. All our organs are getting sufficient oxygen. In fact, here in the US, we do not use any oxygen. I'm not talking about COVID patients. I'm just talking about general population. We don't start any oxygen unless the oxygen saturation drops 88 or lower. Now, in COPDs, in patients who have COPD, which means chronic obstructive pulmonary disease, which is seen in patients who smoke cigarettes, mainly smoking cigarettes. I mean, there are many other people who can have COPD as well. But people who have COPD, we know that their baseline oxygen saturation might be lower. So if, for example, in this case, if his baseline oxygen saturation has always been 91%, I think we don't need to panic. It just means that the treatment needs to be personalized based on what his symptoms are. In fact, if I'm sure that yes, his baseline oxygen saturation is 91%, I probably would say that no, he's not in a cytokine storm right now. Maybe we should wait and see how things go, how symptoms are, and then start treatment as well. But
Yes.
again, I'm not saying as such for him.
Sorry, Shaf, there is one question which actually I feel it's very important. Any special do's and don'ts for kids as second wave has kids as carriers? This is a question from Manjuji. So I think this is an important question because we always think about us and older and adults, but when it comes to kids, I think we have to be a little more careful, and also you could suggest some do's and don'ts for them. Sorry to interrupt.
Sure. So let me start with something which gives us very good hope, and that is we know that the virus does not work very well in bodies of kids. And when I say kids, I mean kids 10 years and younger. There's some data where we have seen that kids who are like 10 years and younger, they get infected with COVID-19, but it sort of is almost as if their body rejects the virus. We don't know why that is the case. WHO also has come out with a statement. I think CDC also has come out with a statement. Although we don't know how to handle with, like, what else can we do with this data, but it's just a glimmer of hope that, kids actually have better immune system against this virus as compared to others. On the other hand, when we go above 10 years of age, even then we see that young adults and others, their body's immune system fights the virus much better as compared to people who are older than, say, 65 or 75. And that is why the risk in people who are elderly is much higher as compared to people who are younger. The other risk factors which are there are obviously people who smoke cigarettes, people who have other cardiac problems, even hypertension and coronary artery disease. And one big thing is obesity and sleep apnea. Those are the risk factors as well. These risk factors are very less, or if not almost zero in kids and younger adults. For that reason, they are better protected. But I would say just keep that as a glimmer of hope. We still need to follow the same guidelines for all those kids and young adults as well. They need to social distance. They need to wear a mask as well. They need to wash hands frequently. In fact, it might be even more important in their case because they might actually act as social vectors. I know here in one of the states, there's a third wave which is happening right now. And the reason that happened is because high school kids started to play contact sports, and that has sort of started to spread it. Those kids are not getting too sick, but they are sort of aiding in spreading the virus. So that's why social distancing, contact isolation is very important in that age group as well. So if there are kids who have symptoms which are COVID-like symptoms, they need to be quarantined as well. And the same kind of precautions need to be taken care with them as well.
Yes, thank you, Dr. Rana. We will get some child specialists as well as we carry on with these sessions. But the thing about children is their symptoms might be different from adults. You know, they might get some bruising, for instance. That's been found to be quite common, you know, around the lips and toes. So the symptoms might be slightly different. So I think we are going to conclude soon. And like I said, we are going to have these sessions every day, hoping to have it every day at 7 p.m. But one last question from Facebook is that somebody is asking, they've got vaccinated, sorry, they've got infected and now they've recovered and hopefully they've got antibodies. Do they still need to take the vaccine, or is it already the antibody response has been generated and they don't need the vaccine?
No, they still need to be vaccinated. And usually we say that after you're doing okay, 2 weeks after that, just take the vaccine, because the vaccine generates a much better and stable immune response as compared to the COVID virus.
Okay, thank you, Dr. And that's extremely good advice. Thank you all for joining. We have reached the end of the session. Namaskar Chusarni और भगवान से यही प्रार्थना है कि जल्दी से जल्दी कोविड से सब लोग बाहर आ जाए और कहीं और फिर से कोई वेव ना आ जाए. So we will, I think it's Dr. Rana again tomorrow, if I'm not mistaken. So we'll take some more questions. But we are aiming to get different specialists, including psychiatrists and child specialists over the week. We'll see where we reach to. Now, there is a question, Ash, somebody was asking about the shop which sells oximeter. So I think we'll put it in the Facebook.
We'll put it on the Facebook.
We'll put it on the Facebook page. If you could share the details of the shop. So thank you all. Namaskar. Namaskar. Saini was join core. Prarthana also works, and along with medicine. So I think both of the things should be done side by side.
Stay healthy,
Thank
everybody.
you. Namaskar.
Namaskar.